I'm back live.
What are you thinking?
What's up?
We're with Ron Guy.
That's right.
Yes.
Support live music, hire live musicians.
Yes.
That's me.
We got one of the mayors of the town, Mr. Josh Hoy.
Yeah, brother, good to
They're
see you all.
saving and reserving our
Peace and love
seat.
to you. Check it out. Check out the beer, Christine.
So
Beautiful.
good.
Telephone.
Telephone.
It's for you.
Oh, hey.
It's
let me pick that
Ecuador
up.
calling.
Ecuador.
Yeah.
They're giving us their table.
Hunt's famous dog.
Alright.
Hey, buddy, you want some water?
Well, welcome everyone. We're at our lunch with the doc today. We're at Sapphire, which is an amazing place to eat. We're eating at the pantry today, and we're just excited to be out in the sun. It's like beautiful weather. Springtime is totally sprung, so this is really fun. So we'll just introduce Rachelle. Rachelle's with us today. So usually we've had Dr. Gary, but we, as most of you know, do integrative medicine, meaning we bring together the best of many healthcare disciplines to provide amazing treatment for our patients. And Rachelle's one of our healthcare professionals at Health and Balance, and so she's our nurse practitioner. So Rachelle, would you just tell us a little bit about who you are and what you do and your experience and everything?
Alrighty.
And then we'll go
Well, how
inside
about
and order.
you go order,
I'll go order.
and me and Rochelle will sit down,
Yes.
and we'll get going while you,
Perfect.
that you can buy my burger on that, and buy Dr. Rochelle's on.
Please.
All right, they
company
have
card.
the best burger. You can get grilled onions, cheese.
The onions, please.
Okay, cheese.
Do you want a bun?
Yes.
Okay, perfect. We're just gonna get the works today.
I'm excited.
All right.
Oh, you just got barred. All right.
Awesome.
Sweet. All right. So. All right. You,
You guys want to take over this table? It's
up to you.
Ocean behind you.
yeah, if you're done,
I like it.
Yeah, no. Why don't you do it? I'm gonna give Ron his gear.
I'll,
here. Why
I'll
don't you
step
guys
on
get
Ron's
cozy?
board. Hey,
Right.
buddy. Hunter. That's Hunter.
Ron,
All right, you guys should
give up our
totally.
table and let these guys get cozy in here.
You guys totally have the seat now.
You want the
Yeah,
rest of
I'm
this,
done.
bro?
I'm done. Good to see you. Health and Balance has helped me so much for 25 years.
Exquisite.
I love Health
Yeah,
and Balance.
big love
Thank
to the
you.
Dr. G. Can't
Big love.
recommend that stronger.
Dr.
Yeah,
G.
Master,
Love.
Dr. G Love, the master healer. We love you, bro.
Woo.
Right.
Bye, guys.
Yeah, these guys.
So
are
good to
fun.
see you. All right.
Fantastic. I'm liking shade.
This is the cool thing about Laguna.
Yeah.
Is community vibes. Everyone's around, hanging out, having
Waving
fun.
to everybody you know.
We're down right across the street from Jack in the Box at Sapphire. So good. Pantry, burgers, glory. It's like most everywhere with Mrs. Rochelle. So, maybe like give us a little bit of your background. How you got into health, how you got to Health and Balance, why you love what you do, all that stuff.
Alrighty. Let's see. I was counting today. I've been a nurse practitioner for 10 years. So that was a little bit scary to realize that much time has passed, but I absolutely love it. So I started my early nursing days. I was an oncology nurse, so I worked with cancer patients, and I loved that. And you're very sick. I went back and got my nurse practitioner, which is a master's degree in nursing, as well as advanced training, advanced diagnostic, prescriptions, all of those fun things. And then I went back into oncology, and again worked with some very sick people. And it was a very needed time. I loved it. I enjoyed it, but at some point, kind of got burnt out. And, so I needed a change.
How long were you there for in oncology?
Total, so probably about 7 years.
Oh,
And
really?
During that time, 2 or 3 years in there, I did some clinical research while I was in school with neurology, with stroke patients. So overall, some very debilitated sick people. And it was very satisfying. I loved helping people. I helped them, get better, and was there in their time of need, and it was very challenging, but just an amazing, amazing time. And it just came to the point where I needed a change.
Yeah.
I knew that I wasn't providing the best that they deserved, as far as just, there's a lot of very sick people. And so that's the beauty of being a nurse practitioner. I was able to kind of shift my focus and personal needs and family life and all those wonderful things. And so I got into more of the integrative practice with chiro, with medicine, and I loved that combination of using more of a natural approach instead of just prescribing a medication for every single thing, because I did a lot of that. Every problem had a pill versus just practical things that we could do to fix pain, to fix sleeping habits, to fix headaches. Let's look at some dietary changes. Let's cut out some of the junk that we know is really causing some of these problems.
So you weren't really seeing that in where you were originally.
No, and everything was pretty much treated with a medication. And so I love the more natural approach. I mean, certainly medication has its place,
Yeah.
but I love the fact that we can help with more structural components or dietary components or natural IVs or some of the other things that we can offer. And so I love seeing people get better. And that's an amazing, amazing thing that is just, I celebrate when they feel better. And, you know, sometimes they do the happy dance when patients come in and say, wow,
Yeah.
that thing doesn't hurt anymore. And, you know, we're cheering. And that's just an amazing, I love it.
Yeah.
I love it.
So good.
So I've been with Health and Balance for about a year. I've been in this integrative model for probably about 4 years, 4 or 5 years. And
Oh, okay.
It's a fantastic fit. I really enjoy it. So I love bringing the experiences that I've had up to this point and then incorporating, you know, have learned more on the integrative side of things. And I think it's just an absolute best fit. I mean, certainly there is a place for medicine, but there's so much more that we can do. But, you know, even the integrative side can be limited a little bit by what they can't do with medicine. So I think it's a fantastic blending of all the multidisciplines that we bring the best to the table and the patients benefit and make it an amazing experience that you don't see anywhere else. I think we have a market on such an amazing component of bringing every different important piece together.
Totally. It's awesome.
So, yeah.
So where were you before you got to Health and Balance?
I was at another practice called La Paz Spine and Rehab.
Okay.
Yeah.
And they did kind of similar
Yeah.
treatments and
Similar.
stuff?
Uh-huh.
Were you
Similar,
doing IV stuff? And
No. So they're in Laguna Hills, and they had the medical component and the chiropractic component. So this is more the natural side also.
Okay.
So they didn't have IVs. So having been an oncology nurse, I did a whole lot of IVs. So that's really fun to bring that back up and use those skills.
Yeah.
And so I love doing that part.
That's cool. So I don't know, I just came into the conversation. Did you already talk about kind of your work before and how that's been different than, okay. Cool.
Yeah.
That's super awesome. Exciting to
Worked
see.
with some very, very sick people that, didn't always get better. We would absolutely help them in their process, but, you know, sometimes the disease load was, it was very sad, and it was a very special place. It was an honor to help them through that process. But I like when patients get better.
Yeah.
I like when they can go back to doing the activities, the surfing, the biking, the dancing, or just the fact they can get up out of bed without pain. That's huge.
Yeah.
So how did you originally kind of fall in love with like health and even want to become like a nurse practitioner? Like what was that original like catalyst that kind of like...
That's such a funny story. Out of high school, I didn't know what I wanted to do.
Okay.
I grew up in a small town. I graduated at the top of my high school class, but I didn't go to college right out of high school. You know, just some life and some stuff, and I didn't know what I wanted to do. So I moved from Oregon to California. I worked for the first couple of years. And I said, you know what? Answering phones, this is too boring. I've already maxed out what I can do. Receptionist, clerical work, I need something more challenging. And I had taken anatomy in high school, and I loved it. But at that point, all I could think of was graduating, and you know, I was an athlete, I was very active.
Yep.
All I wanted was to get out. I didn't really have a plan. And so decided, I think I'll be a nurse. Okay. So I went to the local community college and realized, oh, there's prerequisites. Oh, there's a big old long waiting list to get into nursing school. So we started that process. So I took some night classes while I worked full time just to get the prereqs out, got on the waiting list, got into the nursing program. That was amazing. I was very involved with the Student Nursing Honor Society and all those fun things. Oh yeah. And then graduated, worked for a full year, night shift, oncology at UCI, and that was an amazing learning experience. And worked for a full year there, then went back to school and went to Cal State Fullerton to finish my bachelor's degree and my
I think we got a friend joining us.
We have a friend joining us?
We have a friend joining us.
We love it.
Woo!
Can you
Trisha
say
and
hi?
Asher, baby.
Say hi.
Hi there. Thanks for joining us.
Yeah, what are you guys talking about?
Today we have Rachelle, our amazing nurse practitioner,
Hi.
and she is telling a little bit of her story and then talking about
Nice.
IVs and some migraine treatment.
Great.
So right now we're just kind of talking about her story. You guys want to pull up a seat for a little bit?
you
guys-
we'll see how the baby does.
Oh,
But
yeah.
I'd love to listen for a
Okay.
little while.
Come on in.
All right.
And
Miss Trisha is a longtime member of Church by the Sea where we go, and she babysits a lot of the little ones from the families around.
Yeah.
Yes. Hi, Asher. You're so sweet. Hey,
You like his shirt?
Buddy,
Yes.
Cool runs in my.
family.
Oh,
Dude,
that's
I don't
good.
think you could be wearing a more truthful shirt.
True.
Come on.
So true that.
True that, dog.
True that. True that.
I know his dad. His dad's the man. He's,
Yeah.
Yeah,
Him and Mo do a lot of music together.
Very
Your dad and Mo, so good.
So good.
They have fun.
Yay.
They
Maybe
have-
you'll be rapping with him one day.
I know. Maybe with Asher.
Yeah.
Yeah, we'll rap together. Awesome. Thanks for joining us. Well, let's keep hearing the story. So
Can you scoot in a little bit?
yeah, we're getting
sun on
out of
your
the
head.
sun.
It's kind of
No worries.
interesting. For the,
Okay, so where were we? We were talking about you getting into nursing, all the prereqs, everything,
Yeah.
and
Let's see.
yeah.
So you're at night.
I worked nights from 7 p.m. to 7 a.m. So all night
Wow.
long, baby,
Wow.
for a full year. Yeah.
With oncology patients.
With oncology. So, yeah, I was at UCI, worked the night shift, and it's funny when I look back now. Nursing standards have changed. Back then, I had 6 patients, and they were very sick. You know, blood transfusions, chemo, problems, you know, everything that very, very sick people need. And so now the ratios have changed, so it's 4 or 5 patients per nurse. And so I think that just proves that I've been around a long time.
Yeah, totally.
And so, you know, it's safer for patients to have, you know, less patients assigned to one nurse. And nurses, we need the sanity of
Yeah.
being able to give our best for our patients and not be completely overwhelmed with a very heavy acuity. Yeah. So I did that. I worked for 1 year nights. I was able to shift to days, and I went back to school. So I worked full time and went to school full time for 4 years. So I finished my bachelor's degree. I had an associate's degree in nursing with an RN license to begin with. Worked for a full year. Went back, finished my bachelor's degree, and immediately enrolled in my graduate program. So that period of life was pretty busy.
Seriously.
Full-time work and full-time school for 4 years.
Wow.
That was busy.
So-
It was good. It was doable.
Yeah. So
That was-
that's kind of like how you got in, and then from there it's just kind of morphed, and the career's changed, and now here you are, Health and Balance.
Yeah.
So awesome. Well, that's great. We love it. How about you, Trish? How do you know Health and Balance? What's been your experience with us?
Well, I love that Lisa and Gary are husband and wife, and they teamed up and they met each other in chiropractic school in college, and there's a lot of history there. So I love doctors who have just a chunk of history you can trust.
Totally.
And when they're, husband and wife, that's really a great team to
Pretty
trust.
fun.
Yeah. And then it was funny because I'm from North Carolina. So my thesis in high school was antioxidants. And my brother was like, my sister's smart. Like, she's doing antioxidants. Like, nobody heard of that in like 1999. So,
No.
I just gravitate to Health and Balance.
I love it.
Yeah, I've just always been interested in health. Yeah.
That's awesome. And it's been fun to have you at some of our little events and
Yeah.
just soaking up the info and learning. And
I
stuff,
love
so
the
that's
community
awesome.
day. That was really good.
That was
And
fun.
essential oils was really good.
Yes. that was
And
fun.
the toxin bath, foot bath, that was interesting. Everybody should try one.
It is interesting. You get a lot of murky water coming out.
Blood.
So maybe
Yeah.
Dr. Shell can explain what that is.
Yeah.
Detox foot bath. What is that exactly?
Detox foot bath. That was something new that I learned coming into this type of practice, and it's incredible. So it's an ionization process. We have these beautiful little tubs. You put your feet in our suite. We have a beautiful ocean view of this beautiful ocean. We put this little coil in there, and what happens is there's an ionization process. So the water, with that process, it opens up the cellular permeability, and all of the toxins come out of through your feet. And so you have this
Interesting.
water that turns this lovely orange color, and then there's this nice frothy sludge. It's so gross, but it's coming out, and so it's nice to know that all those toxins are being able to come out through your feet.
Yeah.
And so, it's part of
It's
our detox
painless.
code. Yeah, it's painless.
Yeah.
The water doesn't bubble. You're just sitting with your feet in some warm water for
Yeah.
about 30 minutes, and you're detoxing.
Wow.
That's awesome.
That's so interesting that the ionization process opens up
Yeah.
for your skin to become more permeable, so it just releases.
Yeah.
So the toxins can come out through your feet.
Interesting.
Yeah, the magnetic pull to that, the positively and negatively charged ions in the water have that magnetic pull of drawing the toxins out.
So what are
It's
the
pretty cool.
benefits of that?
So it's helping mobilize toxins out of the liver, out of your system. I know that when I've done it, I just slept better that night. So if somebody is ill, or if maybe they were on some medication, or they're trying to just detox, that
Yeah.
overall for healthful reasons, or needing to get medications out of their system, that helps detox. As part of our detox program, we can do it as just a one time. Let's feel good. We can incorporate it into several times a week as part of somebody's program that they're looking for
Yeah.
detox.
Yeah.
So kind of whatever you're needing.
That's awesome. So what about, I know today we were kind of wanting to talk about IV nutritional therapy and some migraine treatments. So that's been super fun to start doing IVs at Health and Balance, and we've just seen so many benefits for our patients doing that, and along with supplementation and the nutrition protocols and detoxification to really provide the IVs is amazing. So yeah, let's hear a little bit about the IVs and what they do, and who would love to have them and everything. Asher's loving it.
Yeah.
You're loving
He's like, I want a detox foot bath.
You want a detox
Get all
foot
those
bath?
toxins out.
Yeah?
That'd be awesome.
That'd be so awesome.
So yeah, our IVs, we do a bunch of different types of nutritional IVs, and they're mostly vitamins, so it's an injectable form. And one of the benefits of that is if somebody's gut is not healthy, if it's just from toxicity, from overuse, from poor emptying and evacuating patterns and habits and everything, nutrition has a really hard time absorbing. So even though somebody may be taking supplements, their body's not able to break it down and absorb it and get benefit from that. And so then they're not receiving those vitamins and nutrients and supplements that their system needs to help feel better, to function better, all of those things that we're looking for. So we can do an injectable form. And so we mix that right there in the office. I fill the bags full of the different recipes, the different food's ready.
I can get it.
But yeah, so the different IVs help for different things. So one of the things that we do all the time is, or I should say, is our most frequent, and it's kind of the foundational component. Most of our other IVs are built off of it, but it's called the Myers Easy. Yeah, little guy's exploring, running away.
Myers Easy.
So a Myers Easy, it was made by Dr. Myers, and he would have his patients come in and get their nutritional support. But it's chock full of vitamins. So vitamin B5, B6, B12, B complex, some calcium, some magnesium, some vitamin C. So things just to help boost up what your system may be lacking, and it's immediately absorbed because it goes directly into the bloodstream.
Oh. So if you were to take that orally, what's happening?
You would probably lose some of the full potency within the absorption process. And every body is different on how well they absorb. And so this is an immediate absorption.
Oh wow. Oh yeah.
Yum!
Thanks,
I'm
my
so
man.
excited.
Thank you.
You guys, we just scored. We just got Sapphire Pantry Kobe beef
Karen,
burgers.
I got you one without
So
onions.
good. Some arugula.
Karen, I think this is yours.
Oh,
Yes.
you guys.
No onions.
No onions,
So if you
please.
have never gotten the Kobe beef burger down here,
Oh,
it's amazing.
So good.
Unfortunately, they just raised the price from 10 to 12, and a $10 thing like this is amazing. 12 seems,
That's good.
it's just a little sad for me, but it's okay.
But it's
you know?
actually reasonable for them. I mean,
It's
with the
reasonable
value
for them. I
you're
mean, look
getting.
at that, look at that bad boy.
Look
Kobe
at
beef,
that.
garlic
Oh,
fries.
wow. This is good.
Sapphire Pantry. You just know how to treat us well.
So I guess we'll let Rachelle eat in peace without a camera in her face. So just to fit,
Did we finish everything off? Did we talk about migraines?
No, we
Oh,
talked about
let's-
some IVs.
Okay.
And actually I can finish up. So the Myers Easy is kind of our foundation. Anybody can do that one. That's a nice tolerable dose. It takes about 30 minutes. It's fantastic for just the overall health. Or one of the things that we really did a lot during the whole cold and flu season, and this year was awful. I mean, as far as there was just a nasty virus and bug and whatever going around. But people come in when they're feeling a little under their weather, or if they feel something's starting to come on and they don't have time for it, they have an event, they have to travel, they don't want to, nobody wants to be sick. They come in, they get an IV, and then we can add other things to it specifically for your needs. So we can add some extra glutathione, which helps with the detox process. One of the things that I absolutely love, it's my new favorite thing, is silver. We use accelerated silver.
Yes.
Awesome.
So cool.
So silver pretty much kills on contact. And what I mean by that is any virus, any bacteria, any fungal infection, we can put it into an IV, and people recover so much faster.
Really?
So we had people come in and they full on had flu symptoms. They had the fever, they had the cough, they had the body aches, they had influenza. And we would give them an IV, we would give them some silver, and they weren't feeling, everybody's different, but they were feeling well enough to go back to work the next day.
No way.
And so, oh man,
So
it's the
cool.
best thing ever.
Yeah.
And so we have it where, it's a topical. We can have people gargle with it if they're having sore throat issues, whether it's strep, so a bacterial infection, or viral infections. It's kept me coming to work and not having to call in sick myself, my family. And so that's one of the other things I love, being able to help people come in 30 minutes, feel better, and not have to miss out on work or life or whatever, because nobody wants to be sick. Nobody wants the sniffles and all that craziness. No. And then some of the other IVs we can do, we talked about detox, so we have specific IVs that help with detox, help mobilizing the toxins, get that out of the system. Some other immune, so a stronger immune, so lots more ingredients and other things that really help boost the immune system for somebody who just really needs even a chronic illness that helps boost their own immune fighting ability. There's some for performance, so if it's the weekend warrior, or they want to boost up before a competition, it's natural. It's all vitamins and supplements that goes directly into the muscles or into the blood. There's another one for mood elevation as well as stress. So it helps support the adrenals, which is our main organ that is affected by stress. And so I love it because we're directly affecting somebody's well-being, and it combines beautifully the medical technique of starting IVs and giving a medical treatment, but with the natural side effects. And so there's no side effects. So all the other side effects that medications tend to come with, but that's not here. So I love it.
So
Love it. So
And there's also an IV that we have for migraines too, right?
So we have a mix for acute migraines. So people can come in when they're wanting to hide from the light and be in the fetal position with their head ready to explode, and that will help cut that acute migraine by supporting what their body is lacking. And very aware that migraines, everybody has different triggers, different reasons for them. But this will help with that. And then we have a specific diet and supplementation process that we can incorporate in to help minimize the effects of migraines or minimize the frequency. And there's a whole gamut between the chiropractic adjustments, between the dietary, between the supplementation, but certainly an IV. So so there's IV, but then we also have another therapy called spinal cap, and that's it's amazing. So basically it's a device, there's no needles, there's no poking, but it's a tiny little plastic catheter, so like a tiny little straw we put way up into the nose and spray some lidocaine, and that hits this sphenopalatine ganglion, which is the bundle of nerves that controls the whole pain sensation for the entire head. And so we've had some great benefits with that. And that can be a series of therapies depending on how each individual is, how often they have them, how significant they are.
Wow, that's cool.
So I love having tangible treatments that we can help somebody with without having to put them on medications that have all the other side effects, and it takes a while to see benefits. And we are definitely helping people and their current conditions and changing their life. And that's the most rewarding part, is changing people's lives.
So true. That's what it's all about. It's about changing
Why
lives.
we do what we do.
So good. So if any of you have any questions, you can go ahead and comment on there, or just if you want more information, we can always email you more info on the IV Nutritional Therapy, get connected with you on Facebook and everything. But I think we've gotten so much good info from you, Rachelle. Thank you for your time and just your expertise and everything. And I mean, honestly, the IVs are amazing. We've had so many people benefit from them, and you can see the ocean. And so really, if you haven't tried, just come on in for an IV. They're so amazing. And also the migraine treatments. I mean, from what Rachelle was saying, with the IVs to the Sphenocath to chiropractic and therapy and massage and what all that can do is just amazing. So there's so many benefits to migraine treatments and just IVs in general, just general health. So much to be done, so many amazing things to take advantage of, and we just hope you're having a good day in Laguna Beach because it is beautiful. You guys should get out on that water and go stand up paddling or surfing or just laying on the beach. Like, everybody's got to just enjoy this day because Laguna is just the best. So thank you, Sapphire, for this amazing meal. We're so excited to dig in.
This looks amazing. Look at this.
Yeah.
Big old some arugula, big old
So
Kobe
good.
beef burger.
So good. So every Wednesday, 12:30, we're doing lunch with the doc. It'll be with one of our healthcare practitioners that just has so much advice and amazing knowledge to share with you all. So thanks for joining us today. We hope you enjoyed it and gained some good info, and we'll see you next week.
Come see us.